So as Danielle said, I'm Teresa Cruz, and I've, in addition to the specific topic areas that I've worked in the past, I've also done work in policy and evaluating policy and trying to figure out how to measure policy and policy advances, because it really does look different from measuring programs in how things move forward. And often, for those of you who've been involved in moving policy forward, it's like a couple little tiny steps, and then you'll take a big leap when some event happens, and then you might slide back, and then make efforts forward, and things depend on different schedules, like when the legislative sessions are, and those kind of things. And so it has a little bit different frame from when you're working on programs. But so today I'm going to talk about the cinch policy scan of Bernalillo County that we're working on in partnership with all of you, I guess, as collaborators. So just to give you a little bit of background, I know that you wouldn't be working on this if you didn't know a little bit about chronic disease being an issue. And I haven't put up information today about Bernalillo County because I know you're going to be getting that from the data scan that's being done. But I did want to give you a perspective on what's happening nationally. We have about 1.7 million deaths every year in the United States due to chronic diseases. And these are kind of the big four: heart disease, stroke, cancer, and diabetes. And so those are the main diseases that we're talking about. We're talking about chronic disease, even though there are others. So what are we doing with health policy, and why do health policy? And the basics behind that is that you want to try to affect, and as an epidemiologist, that's how I look at things a little bit too, is on the population level. That it's a lot harder, takes a lot more work, a lot more effort, and a lot more cost to work with somebody one-on-one to address an issue, where if you have a policy in place, it could address it on a population level much more broadly and much more quickly. And as an example from my background, working in injury prevention, many of you were around in the 70s when you didn't have to wear seat belts. So everybody knew that it was better for you to wear seat belts and that it could prevent injuries and deaths. But people, it was about 15% in the 60s and 70s, about 15% of people who wore seat belts. And Tennessee, in the early 70s, got the first seatbelt law, and people, lo and behold, started wearing them. And so over the decades, it went from being something where people were told they should do them, and it went up to about 30%. When the law came into effect, it went up to about 60% in places that had the law. And now, probably most of you wouldn't think of getting in your car without wearing your seatbelt. And in New Mexico, as in most of the country, it's about 90% of people wear their seatbelts. And it jumped from that 60 to 70 level to the 80 to 90 level when we started having primary seatbelt laws, which meant that a police officer could pull you over just for not wearing your seatbelt. And so I know there are people who, say, well, you just get thrown clear in a crash, but what we find is that about three out of 4 people who get thrown out of vehicles die. And so you do hear about the occasional one that survives, but that's the rarity. And so with injuries, you have a little bit different picture because the things happen right away, and so you can see those results right away. Unfortunately, with chronic disease, it ends up taking a long time, and so trying to get people to change their eating behaviors, trying to get people to be more physically active are really difficult things. And just all of us in here know that Cheetos are bad for you, but every once in a while maybe you eat a bag of Cheetos. But there are people who have their normal daily intake of fast food, people who have fast food every day. And so trying to see how can we get these behaviors to change, and if you went to each person and said you shouldn't eat that, if you went to a 5-year-old kid and said you shouldn't be eating McDonald's every day, they don't have power to change that. And so by making policies, coming together as a community to think about, and I say fast food, I don't have any, well, I do have stuff against McDonald's, I don't eat there, but not them in particular, but in LA, they've actually restricted allowing fast food restaurants coming into some of the neighborhoods that they think have too many of them, because they think there needs to be more healthy food in their community. And so those types of policy changes, if you have McDonald's right next door and you don't have healthy food available in your neighborhood, then as many of you are working parents, it might be easier to just stop off at the McDonald's on the way home from work and picking up your kids from school than going to find some place that has something else that you can make for dinner. And so when you start thinking about things on a policy level, you start realizing that you can make changes in neighborhoods and communities, and in our case in counties is what we're looking for. So the scope of what we were looking at, initially we had meetings with the Cinch team trying to figure out, and with the PAT team, the policy team, trying to figure out exactly what we could do in 12 weeks. What would be reasonable, and getting the information that we needed to cover without bringing in a lot of extraneous information that might be nice to know but wasn't critical for completing the scan. And so we're really focusing on written policies. If for things that are done a certain way, that's great, but if it's not something that's a written policy, then things like a change in personnel in an office might be able to change how things are done. And so we really wanted to make sure that these were things that were a written policy for organizations or for the government entities or schools, so that they would be something that would be established and lasting over time. So we're looking at legislative and regulatory, so the administrative codes as well as laws and ordinances. And then organizational policies like APS policies, like UNM policies. And then I'll talk a little bit about some of the workplace stuff that we're looking at. And then again, our focus is really on these 4 chronic diseases: heart disease, cancer, stroke, and diabetes. Those were the primary causes of death in our county, in our state, and in the country, and are also what the grant was intended to affect in the first place. So I touched on this a little bit, but I guess I just want to make clear, because there was some confusion both on our part. We were trying to decide what's going to be part of the database and not. And things like plans and proposals and programs are not in the database. Things that are not policies will not be in there. But we have kept file folders to keep track of things that are efforts in the works, that plans that are out there. If those are things that eventually get passed as policies, then they would become part of the database. Or different proposals that could become part of the database as they move forward. And we wanted to recognize that those things do exist around the county. And there are also fabulous programs out there that are being done at the city, state, county, APS level, that those things are happening, but those, if they're not policies, written policies, then they're not going to be part of the database. So our strategic directions, this was another way of focusing what we were doing. The CDC has 5 different priority strategic directions that they're focusing on. Tobacco-free living, so that includes 2 different smokeless tobaccos as well as smoking. Active living and healthy eating, which they combined, and a lot of policies are combined as wellness policies, but then there are also a lot that are separate. And so we, in looking at them for the database, we actually separated out things that were physical activity versus healthy eating and nutrition. And then increased use of high impact quality clinical preventive services. So this is more of the medical side of it, but at a community level. That most of the time when we think about the medical model, we think of a doctor working with a patient. This is thinking of the medical model a little bit differently, where it's looking at what are the policies around the preventive care that physicians give and how they give it in the primary care setting. And so this is more led by the Clinical Preventive Services. There's a manual that comes out and is updated every year, where there's task forces that decide what is considered the best care that primary care physicians can provide when dealing with prevention. So the other two, those first three were our primary, well, four if you look at active living and nutrition as separate things, but those were our primary issues we were focusing on. There were two additional strategic directions. One was looking at healthy and safe environments. And this one, we were focusing on the built environment mostly as part of this. There were also different things on detecting radon in your house, but when we met with the Cinch team, those issues weren't seen as important. Well, especially radon in New Mexico, since a lot of it's being trapped in basements, which most homes don't even have here. And with evaporative air, you don't keep your house sealed in as much as you do in a lot of other areas of the country. But so we focused ours more on the issues of zoning and transit-oriented development, things that would promote active living as well as being changes in your built environment. And then social and emotional wellness, although initially I was thinking this could be millions of things, when you look at the strategic directions and the recommendations, the evidence-based strategies that are there, they're basically talking about parenting practices and medical home models. And so initially we started with a convenience sample where, because of our short turnaround time, we were just trying to figure out who could we get information on quickly. And so what we did was we looked at the largest employers of people working in the county, and not all of the employers are considered county, located in the county, like Sandia is not officially located in the county, but does employ a lot of people in the county. And so we did include them, and we did include Intel for the same reason. And so, in Kirtland Air Force Base. So we looked at data from a lot of these large employers for the county. And then we also had from one of the members of your PAT team, Liz Chavez. She worked with the Solutions Group, and she volunteered to facilitate surveying the members that worked with her to see what kind of wellness policies they had. As you, as stakeholders in this, go through the information, and as you take it out to your communities, you really want to think about what are the things that you want to change, and what are the things that you think are reasonable, because this is how we want things done in our community. And so I think the interpretation and the input from the community is really going to be important as you move forward, because you don't want to try to tackle something that the community is not interested in having. You want to make sure that these are things that as a community you can come together around and feel comfortable with changing. So in looking at, we got a lot of policies, but a lot of them ended up not being relevant. And so after weeding out policies that we didn't find relevant, we went ahead and made a little table here. So we had two people review each of the 83 policies and score them, I shouldn't say score them, but review them against the model policies to see how well they matched up with those. And as might be expected, I guess, that we found that the state had the most policies, and we're the only ones to have policies addressing things around the clinical preventive services, which also makes sense because they look at regulating Medicaid and those kind of things. And the mental health, they also have issues around child care and those kind of things, and so that seemed reasonable. Much of the other policies at tobacco by far had the most looking at it, and the healthy eating and active living, and then it kind of dwindled down as we went through. Oftentimes employers don't have written policies, so that might be something that the community decides they want to work on, is working with individual employers to get them to create actual policies for their organizations. And then many plans and programs exist, which I found exciting, that there are a lot of people who are doing a lot of good work and have a lot of ideas and are doing the right thing, but it's not policy, or not policy yet. It might be something that they're planning on making into policy, or programs that abide by a lot of the guidelines for model policies, but just aren't themselves policies at this time. And so we also looked at the potential areas for improvement. I talked a little bit about the disparate policies, that sometimes you have to look at a lot of areas to just find out about one thing. Also, language is, as an issue, if we're trying to make sure that everybody understands what our laws and policies are, that there may be some language barriers, especially in Bernalillo County, where we have not only Spanish spoken as our state is nearly half Hispanic, but also having a lot of different immigrant communities there. And then specific exemptions, I touched on that a little bit before, is that a lot of the policies did have exemptions in them, and it'll be up to the community to decide, are those exemptions things that you feel are okay, or that you feel need to be addressed and changed, and maybe kind of closing loopholes that might be there. And so those will be with each policy, you can look at those and see what you think about those, and if they're things that you as a community want to address. So the next steps, we'll be finishing up the analysis in the next week and completing our report. We've been asked to provide that to the county by the 21st, so we've already been working on it kind of as we're going along so that we can have it ready, as we wanted to keep the database open as long as possible to put in new things that might be happening. Then we'll be presenting at APHA on October 30th, which will be a great opportunity not only to show other people how great Bernalillo County is, but that maybe we'll be able to learn something from some of the other counties and bring that back to you to see if other people are doing things that might be of interest here. We'll be transferring the database and corresponding code book over to the county so they understand what we've put in there and how to read it and how to enter data in the future. And then from there, all of us as stakeholders and collaborators will be moving forward with the planning phase. And that should entail focus groups in the community, getting other community input through interviews or attending community meetings. Having stakeholders review the documents and information, especially those of you who are on the policy and leadership teams who feel like, I guess that it's going to be your role and responsibility to help decide what the future is going to look like for the implementation phase. And then providing your recommendations as you move forward to try to implement some of the policies that, that you and the community feel would really benefit all of you. So that's the end, and I didn't know if you had questions.
Before I get into this, I'm treating this as a workshop. Before I joined the county, I worked in a PR firm and was the director of government relations, and I did workshops all over the country on how to influence public policy, especially for Native American groups, for those who are disenfranchised with the process, because the process is very intimidating, and it's designed that way. It's designed that way. But you can influence it. And one of the notes I wrote down is public policy involvement is a marathon, it's not a sprint. Lots of people get engaged for a short period of time, get something done that they want it done, or don't get it done, get frustrated and get out of the process. It's really a marathon. And you got to think of it that way. Most legislation takes 3 to 5 years to pass. And I've run into lots of people in Washington and Santa Fe, even people who want to influence the county, thinking they can get it done quickly. Where I've been working at it a year, and I'm just so frustrated. It takes an average of 3 to 5 years to influence the process. We do have a representative democracy, meaning we elect people to speak on our behalf. Lots of times, however, we don't get access to them to let them know what we're thinking. So that's what I'm going to talk about, is how do we access the process, and how do we really influence the process? So I've got 9 steps, and I'm going to start with number 9. I'm not David Letterman. That's why I didn't do 10. You have to know your elected officials. When I worked for Senator Bingaman, people didn't even know how to say his name. Hard to influence somebody if you can't pronounce their name. Bingham. And I would say, really? You want to talk to him? You have to know how to say his name. You have to know who your elected officials are. In New Mexico, we have 5 members of our congressional delegation. I'd like for you to write down who our 5 members of our congressional delegation are. We have 2 senators and 3 congressmen. See if you'll write that down. And we have the only 2 U.S. senators whose home phone number is listed in the phone book. So in this state, access to our elected officials is not that difficult. You can find them. In fact, we can say first names and people know who those people are. Jeff, Tom, used to be Pete. First names. But access is only one part of the process. We got to know once we get the access, what do we want? When you meet with elected officials, they're expecting you to ask them for something. That's their expectation because they represent you. And lots of times people get access, walk out of a room, and I've sat there and the elected official will turn to me and say, what do they want? All right, number 8, know appropriate departments. Public policy influence isn't only around how do you influence elected officials, you also have to know how to influence the agencies that regulate you. In fact, agency rules and regs have the same stature as laws. And oftentimes we take the route of talking to our elected officials and we forget about those regulatory agencies. So as you get into the process, you've got to understand it's 2 levels. And sometimes if you work the elected side, the department side doesn't like that because you're trying to go over my head. So a lot of how you influence the process it's got to be about timing. So I would ask, when I worked in the Senate, I would ask, well, have you talked to the appropriate department? Have you talked to Interior? Have you talked to those folks? No, we thought we'd talk to you first and you would talk to them. No. You got to do your homework. It's really up to the advocate to do the preliminary work, and then you ask the elected officials or the departments to aid you in getting something done. This is probably the most critical of anything if you're trying to influence the process. What's your message? You got to have a message. And it has to be a message that you can say in the elevator. You got to be able to take the complex and put it into about 30 seconds and then have all of the sports stuff so that when you have a longer dialogue, you can have a dialogue. But message is critical. As a part of your message, what you want to do is identify who are your advocates, who are your adversaries, and who are the neutrals. Who are the people that really don't have an opinion on what you're talking about, and how do you influence that? And that's where the message is critical. It's critical. You need to really identify who your constituent groups are. In health, I think, well, there's some obvious things, but what we heard earlier is a discussion around the Native Americans. You can't, if groups feel they were left out of initial efforts, it's hard to bring them along after the fact. Not just Native American, any group. I've been talking to this group around where's business? If business feels we've got a major initiative we're doing and they're being brought to the table after the fact, they're not going to be advocates. Nobody wants to come to the table after it's set and people are already eating. Right? Develop a strategy. And this, to me, is just basic. If you're going to influence anything, you got to have a strategy. If you look at political campaigns, they all work from a strategy. A strategy is basic to me. It's who we're reaching out to, who we're trying to influence, who we need on our side. It's why are we doing it? That's the messaging. It's what are the specifics that we're trying to accomplish. You know, if you went to a group of business folks, went to the Greater Albuquerque Chamber of Commerce and did a presentation on, you know how you can lower your insurance rates? Do you know how you could take care of absenteeism? Do you know how you can do those kinds of things and lower costs? They're going to listen to you. They're going to listen to you because it impacts them. In the strategy, you got to see how you're going to do it. You're going to do it through specific policy changes. You're going to do it through programs. You're going to do how are you going to do what it is you're trying to do? And the most critical part of a strategy, and if it doesn't have this, it's not a strategy. It's impact measures. How are we going to know what we're doing and what we're advocating for got done and was effective? And that's a part of our messaging, is to be able to tell people, we're going to measure this, you're going to be able to know that this worked. It's critical. Number 3 is to create a communications plan, and in this day and age, if it doesn't include social media, it's not going to work. Not going to work. I've watched the 2 conventions in the last week. One I really enjoyed, the other I watched. But I'm telling you, the tweeting that was going on, all of the messaging that was taking place was phenomenal. Unbelievable. And number 2 is you got to foster relationships. This process is about relationships. Not in a bad way, but it is about who you know. And you foster relationships through trust. The worst thing you can ever do in trying to influence the process is to not tell the whole truth or to fib, to lie. I'm telling you, it's a small community of elected folks and staff. If you've lied into the process, if you've misled into the process, you're tainted. The best way to influence the process and the best way to build trust is to be able to say, here are the pros and cons. The best lobbyists I've ever worked with were lobbyists who were able to tell me, here are the people for it, here are the people against it, here's the ups and here's the downs. The number 1 way to influence the process, and if you remember nothing else, just the number 1 way it's influenced is you got to implement and follow through. Sometimes people get what they've asked for and they don't say thank you. And they don't, and even if they didn't get what they asked for, they don't acknowledge the effort to listen. If you don't follow through, and lots of people who do get what they ask for and it's successful, then don't acknowledge the people that help cause the success. And so what happens the next time you come to the trough? It's like, really? Well, you helped me last time. Really? I don't remember the thank you note. And think about it, the next time that you're with an elected official, see if they don't say, what can I do for you? And you know what? Have something. And it might be as simple as, well, I'd like to meet with you again on very specific things. Because that elected official will turn around to staff and say, oh, put in their iPod, need to meet with so-and-so on this issue. They want to be asked. They expect to be. It's just it. They expect, and if they're not, it's, I don't know why I am. And in my world, where I did the schedule, I was told by the senator, I don't need to meet with them anymore. They don't know what they want. So, in a nutshell, influencing the process that's supposed to represent you is a process in itself. And we can do more, we can have more impact if we follow some of these steps and we're thoughtful about it. And we're thinking in the longer view, not just immediate.
So I'm going to begin with a little history of smoke-free public housing in New Mexico over the last several years. So you can go to the next slide. So in 2000, there were 2 public housing authorities in the United States with smoke-free policies. Surprisingly enough, it was Nebraska and Kentucky. I was really shocked to find that it was Kentucky. I wouldn't have thought they'd be a leader in the smoke-free game, but in fact they were. 2005, we had 15 smoke-free public housing authorities. And then you see, 2012, we jumped to over 300 public housing authorities throughout the United States. Interesting, we'll get to what happened in 2006 that might have sparked that a little bit. And then we'll move on to Santa Fe. So in March of 2011, Santa Fe Civic Housing Authority adopted a smoke-free policy that covers about 85% of their units. So 15% of the units, which are actually at the senior sites, have some grandfathered units, meaning at this point, as long as those people are alive, they can continue smoking in their unit. Have a little difficulty with that, but we'll talk about that more in a minute. And then you see, just recently, Santa Fe County Public Housing passed their policy in June of 2012, where 100% of the units will be protected by July 2013. Currently, the process is that anybody coming in after October 1st will be signing smoke-free leases, and then on July 2013, everybody goes smoke-free. An interesting enforcement plan. And that's something else that we'll talk about, that enforcement and implementation are different than policy adoption, as you may well imagine. So the most recent authority to pass smoke-free housing is Alamogordo Public Housing Authority. This one has its own slide for a couple different reasons. One is that it's actually not a smoke-free policy. They have grandfathered in everyone who is currently living at their site. So I don't have numbers of how many units that is, but what will happen is, as anybody leaves, the incoming resident will be signing a smoke-free policy. But that could well mean that they're surrounded by people who are smoking. So it doesn't really, the protection is very minimal. Actually, I'd say non-existent. Of course, it depends on how their units are arranged, but we've had a few conversations with a few people because it kind of dilutes the smoke-free policy, the idea of a smoke-free policy, when in fact so many people are grandfathered in and can continue to smoke. I should probably preface this by saying that while seniors smoke at a higher rate than the overall population, in New Mexico now, it's about 19% of our population are smokers. Might be more like 25 with the seniors, a little bit higher, but we're still talking about a lot of people who are unprotected. So we can move on. Why smoke-free public housing? So the next slide really says it all for me. There is no safe level of exposure to secondhand smoke. Breathing even a small amount of secondhand smoke can be harmful, especially to seniors and children. And that came out from the Surgeon General in 2006. It is possible for environmental tobacco smoke to migrate between units in multi-family housing, causing respiratory illness, heart disease, cancer, and other adverse health effects for those living in neighboring residences. Therefore, the department is encouraging public housing authorities to adopt smoke-free policies. So the word that I want to point out here is encouraging. They're not demanding and they're not requiring. And I've heard different opinions about if they are going to and if it's within their ability to actually tell public housing authorities that if you want to continue to receive our money, which is most of the money they receive, you will have to go smoke-free. Like I said, I've heard different opinions on whether or not that's going to happen. So at this point, they're encouraging. I would say they are strongly encouraging. This original notice came out in 2009, and I believe it was in May of this year, there was a second notice that came out. Same thing, a little bit more information, and a little bit more detail about how one might do it. And we're going to see some of that on the next slide. I'm going to run through the health impacts kind of quickly. I'm sort of speaking to the choir here. We all know that it's not a good thing. Just from the United States, 50,000 deaths a year, 46,000 due to heart disease, 3,400 lung cancer, and then 300,000 children under the age of 18 months that experience respiratory problems as a result of secondhand smoke. The best data that I have says that there's about 300 deaths a year in New Mexico attributed to secondhand smoke. So here's a slide I was referring to earlier. 60% of children are especially vulnerable and exposed to secondhand smoke. So it's true that how are we going to trace that 5-year-old, 3-year-old, 4-year-old today to when they're 60 or 70 and know, if it's not that it can't be done, and know if their present condition is actually traced back to when they were exposed to secondhand smoke as a child. More frequent and severe asthma attacks, allergies and ear infections, bronchitis, pneumonia, respiratory problems, poor lung development, coughs and colds, and actually an increased risk of neurobehavioral disorders such as ADHD. That one was a surprise to me. I never thought of it at that level. And adults and seniors, you can see I had to make my type a little smaller because it expands the list. Heart disease and lung cancer, that's a given. We all know those. I wasn't as familiar with the increased risk of developing type 2 diabetes or multiple sclerosis. Major depression, bone density loss, increased risk of dementia. So the benefits of smoke-free housing. Healthier, happier tenants. I always put that one first. I think from the market rate side, they might not be that concerned with healthier, happier tenants. But they might be, if they think about if people are disgruntled, they might be knocking on their door more often with complaints. Not just secondhand smoke complaints, but all kinds of complaints. And then this is the one that does move more into the private market, which is a decreased maintenance and restoration costs. So the costs can be anywhere from 2 to 7 times higher in a unit that has been smoked in. For example, they need to clean and paint smoke-stained walls and ceilings, go through, replace carpets and tiles with burn marks, and then figure out a way to remove the residue and the odor, which is no easy feat. I've heard stories of having to have sheetrock replaced, going back down to the wood, pulling out all the carpet, pulling out all the tile, not because it's burned, but because the odor of the smoke is so embedded in the actual materials in the apartments. So, how do I get there from here? The million-dollar question. My first slide here is partner with. So I was pleased to hear, as soon as I came in the door, Mr. Murphy said, foster relationships through trust. And that's exactly what this is. So that's why it's not a quick fix when you want to get this kind of a change made. We really recommend that you take the time to develop relationships, real meaningful relationships based on trust, as we learned this morning, with public housing advocates and health councils, city and county officials. You might consider seeking a city and/or county endorsement or resolution. City and county public housing authority staff and boards, the people who are right on the front lines, and then consider forming a task force, which we did in Santa Fe Civic Housing Authority. It was made up of a couple of residents, a couple of housing authority staff, and I was not part of that process, and then a couple of people from the Santa Fe Tobacco Free Coalition, which was just before we birthed the name of Live Smoke Free Santa Fe. And it worked. It worked all right, but there was a question when it was all done, was it really necessary to have a task force? So educate, educate, educate. So for my way of thinking, building partnerships and educating people go hand in hand. So much of what we find is people just don't know. They don't know the harmful effects of the secondhand smoke, and they don't really look to the benefits. Now, I've kind of stretched a little bit in the, no legal barriers, which is one of the first things that come up in conversation is, oh, I can't do that, it's not legal, people have a right to smoke, and we've been through that conversation here a little bit. And the reduced risk of fires gets a little bit of attention, but but people don't see it as much. It's not that visible. There was one fire in Santa Fe County Public Housing a year ago in June caused by a cigarette. So that was another thing that pushed the conversation forward pretty quickly because it was real. And the woman, nobody was injured. Elderly woman fell asleep on her couch smoking a cigarette. They carried her and the couch out into the yard. And she was not injured, nobody was hurt. The apartment evidently was severely destroyed, and I heard about 3 months ago that it still wasn't, that the county hadn't gotten it together to do the restoration they needed to do. Got together, got the money, I'm not sure what it was, but you know, it's a huge problem for them. So that's a story that we can tell a lot because it happened there. They can tell that story a lot. Remember so-and-so when her apartment burned? Because I scared everyone to death. So back to create partnerships. This one is engage residents as allies. And I use that language on purpose. Some of the most vocal people you'll find are the smokers. So I've done a couple of meetings at the public housing sites, and there were 6 people there and 4 of them were smokers. So talk about a difficult conversation because they wanted to meet me, they wanted to talk to the person who was taking away their right to smoke. And I was like, well, that's not really what I'm here for, and try to move the conversation into something constructive about you will be able to smoke. There'll be areas where you can smoke, and we can offer you some assistance in cessation, and there's nicotine patches, and there's all that kind of stuff. But the concern of open invitations to residents is just that, is that you draw the people who are afraid of losing their right to smoke, and don't draw the people who are thinking that they need to show up to help move this forward. It's just an interesting piece that I've learned. I wouldn't say the hard way, but it wasn't fun. So, and then conduct a resident survey. Important to let people know that you're thinking about this. In county housing, the survey happened about 6 to 8 months before there was any conversation about a policy. It was tied to a policy conversation, but they weren't really seeing anything. And in civic housing, I'd say it was about the same. It was several months between when the survey happened, and the surveys vary from 3 questions: are do you smoke in your home? Do you smell secondhand smoke in your home? Would you like to not smell secondhand smoke in your home? I can't remember what the questions are. To a more involved survey with like 10 questions about smoking behaviors and other behaviors happening in your family. So, will it mean that someone who has to quit smoking is going to be happier about quitting? Probably not. But does it gain us a lot of goodwill at that site? Absolutely.
But I wanted to tell you about a policy that we have for our TIP, which is our Transportation Improvement Program, which is the program that prioritizes projects from all those local jurisdictions and then decides which of those gets funded. So in the last, I think it was about maybe a year and a half ago, our policy board, which our policy board is called the Metropolitan Transportation Board, they set a policy to say that 10% of funds that come down from federal funding would go towards public transportation, particularly with trying to alleviate congestion on river crossings. So does that make sense? Okay, so that's one policy, that's a written policy, a resolution that was passed by our board. So I'm going to talk a little bit about a component of active living or the built environment. When we were talking earlier, when I think about the active living or the built environment, the things that I think about that's going to make a better, healthier built environment is transportation and land use. So do we have an efficient transportation network that provides opportunities for all modes, so biking, walking, public transportation, and cars? And then does our land use support that? Do we have compact development, appropriate places? Do we have opportunities for transit urban development and multi-use? So if you haven't heard also, the city of Albuquerque recently changed some zoning so that in some of their commercial areas, C1 and C3, these are their commercial designations for zoning, they can now do multifamily housing, what they call R4. So that's another policy change in land use, along with the efficient transportation networks that's going to help us create a better built environment. So first of all, what's Complete Streets? Complete Streets, the national coalition was founded in 2005 and, by a variety of advocacy groups. And so their whole focus was to get people to pass policies and states and local governments supporting complete streets. And as of 2011, there's been endorsed or adopted 224 U.S. jurisdictions and 23 states. So they've had quite a lot of success over the years of passing these policies. And they provide a lot of information on their website about how to go about talking about complete streets. Because you can have this complete streets policy, but then, you know, then there's the implementation piece, right? And so for the implementation piece for transportation or complete streets, it's going to be the design standards. Like with land use, the implementation is going to be the zoning. So it so happened that because there was just good timing, we were able to update the Doñana County design standards at the same time as passing the Complete Streets Resolution. And then the city of Las Cruces, in their own Complete Streets Resolution, indicated that the next time they updated their design standards, they would ensure that it would incorporate complete streets. Why are we doing this? One, rising obesity trends, and particularly in New Mexico and in young children. Rates are increasing rapidly for obesity. Inactivity is a factor in many diseases, as you know. Cardiovascular disease being the leading cause of death. There's more and more studies showing that if you have places to walk, if you have comfortable, safe places to walk, even just have a sidewalk in your neighborhood, that more people are going to walk. So you have to provide those facilities first, and they will come. People will start walking. So we have principal arterials, which are really our main thoroughfares. We call them principal arterials, but even though they're designed to bring traffic through the region, they're not all the same. So the best example is Paseo del Norte is a principal arterial, Coors is a principal arterial, and Central is a principal arterial, but they don't operate the same. And if you're gonna redevelop something on Central, that's going to be very different than redeveloping something on Paseo del Norte. So we're trying to bring this into our guidelines. So I don't know if you can see this, but so basically the guidelines are kind of like, okay, you're in a suburban or an urban environment, your adjacent land use is primary residential or commercial, and you're on a certain type of street, and here are some design guidelines. And there are ranges, but there's also minimums. So, you know, especially say you're in a high commercial activity area in an urban core, you're going to want a 10-foot sidewalk versus you're in a suburban area that's primarily residential, you may not need that wide of a sidewalk. So it provides a variety of ranges for those types of things, from access control to bike lanes to street width and so on. And this is the end of my presentation, but I just want to give some examples. Here's Silver Bicycle Boulevard. You don't always need a bike lane. In some cases, you can use the width you have and make a fairly safe street. Parkways and shade are really important, especially in our environment, between the pedestrian and where the automobile traffic is. In a rural area, you might just need to have a wider shoulder. Not necessarily always going to put a sidewalk in, or you have a parallel roadway that serves the function. Vital to have safe crossings, especially at schools. Vital to have transit accommodations. And high activity destinations, again, are going to look very different than other areas.
One of the strategic directions of the Community Transformation Grant is healthy eating and active living. So the joint use agreement also allows us to work around the active living piece of that. So you can go ahead. So we have, we've talked a lot today about the built environment and about some of the other issues in Bernalillo County, but a lot of communities lack safe and adequate places for children and their families to exercise and play. And one of the things that we found out recently is, and I think it was Teresa this morning mentioned that Bernalillo County and Albuquerque specifically have more parks and open space per capita than, I'm not sure if they have more than every other community in the country, but they have more than a lot of communities, more parks. And that's great, but we found out from talking to our Parks and Rec folks that the perception among the public is not that they don't have access to parks, but that parks are unsafe or not usable. And so safety is an issue. And also, as we've heard today, obesity is a serious problem nationwide and in Bernalillo County, and it's an epidemic that has lasting effects on our health. And it's a major risk factor in many chronic diseases, and as you have already heard, and already know, I'm sure, children and adults who are overweight and obese are at greater risk of chronic health problems, including these, which is why the CINCH project exists, to address chronic disease in Bernalillo County. And increased physical activity can translate into lower obesity and chronic disease rates and hopefully into healthier populations. Obviously, the obesity epidemic is multifaceted. A lot of things have contributed to the obesity epidemic. It's not just one thing. There are many risk factors that contribute to chronic disease as well. But one of the things we do know is that lack of access to recreational facilities has played a significant role in rising obesity rates. And that's particularly true in low-income communities and in communities of color. So there are many solutions, but one of them is that local governments, like the county or the city, can partner with school districts through what are known as joint use agreements to increase community access to recreational facilities. And these are just some of the many communities nationwide that are already have already adopted and implemented joint use agreements. So what is a joint use agreement? A joint use agreement is a written agreement between school districts and local government to share the costs and responsibilities, and those include security, supervision, maintenance, repairs, and potential liability that are incurred by opening school facilities to the public during non-school hours. And this differs from, this would be opening schools up to the general public. This differs from, we already have an agreement in place or a policy in place that permits the use of school grounds by sports groups, clubs, organizations, as long as they get permission in advance. So that's very different from what we're trying to accomplish. We're hoping to open up the schoolyards and grounds to the general public for just physical activity use. So as I said, we're already doing some work in New Mexico. So it's not a novel idea. And actually in New Mexico there are state laws that authorize school boards, and Jeannie, you can help me out here because I'm not as familiar with it, but the state of New Mexico authorizes school boards to join with any municipality or county in conducting and maintaining a recreational system. So that's already in place at the state level. It's not something that can be accomplished in a year's time frame. And I understand that administrations change, as we were talking about this morning, but we have to have leaders who are committed to seeing it through the long term. So that resolution is a huge first step in the process of just getting the board to officially and formally voice their support of a partnership with APS It doesn't mean there's anything concrete that's been done, but it means we can move ahead. So the next steps are to meet with, for the county, to meet with APS to establish a relationship and to start the dialogue about planning. We're trying to get a meeting together in a couple of weeks with some of the decision makers at both the county and APS. And so far that's coming together. But that's going to be a really important thing to do to start the process. And then also to identify other key partners, and those would likely be the people who serve on the task force, like excuse me, the ABC Community Schools Partnership, the city, and various other entities. And then and the task force would be given the task of developing a work plan, and then that would ultimately lead to a joint use agreement. So it's a lot of work that lies ahead of us, but I think getting a formal resolution passed was a huge accomplishment. The Change Lab Solutions is made up of legal experts, so they have quite a good background in this area. The Prevention Institute has some resources, and then this site called Kaboom Inc. has some grants available to communities that are interested in doing joint use. So I'm about to lose my voice, so good timing. Questions?